Hello again, everyone. Welcome back to my podcast. It is my great privilege and honor to introduce my special guest today, Darshak Sanghavi, Chief Medical Officer at Babylon Health. Darshak, thank you so much for setting aside the time and welcome to the show.
Yeah. Hey, Patty. Great to be with you. Looking forward to the conversation.
Thank you so much. Why don't for the benefit of our listeners, maybe you can give us a quick overview of who Babylon Health is and what your role
Yeah.
is.
Yeah, sure. I've been with Babylon since earlier this year. Babylon, essentially a global digital health company. And our philosophy is that we want to get affordable, accessible, and quality care to everybody on the planet, which I guess is really the sales pitch that got me most excited. And as you might have heard, got it started in the UK, then expanded to Rwanda, Asia Pacific, services in Canada, now the US. And so I came on here really to help out as the global chief medical officer to think about how we can really deliver on that promise. Excited.
Right. Yeah. And of course, just to get this one out of the way, you also went public through a SPAC event. Am I right?
Yeah, it feels like it may have already happened, although it's planned for sometime in the next few months.
Okay.
So that is our event coming up, and we're excited about that as well.
Okay, excellent. All the best. All the best with the SPAC move as well. So, in terms of your clients, and now you're a global organization. Let's talk a little bit about the United States, where obviously there's a big opportunity for your company. Who do you serve? Is it payers, providers, employers, all of the above, more of one versus another? Can you give us a little bit of insight into that?
Yeah, it's a great, as I think about it, the tagline is that we want to deliver healthcare to the palm of everybody's hand. So ultimately, the people we're serving are really patients and members worldwide. Now, the way we get to that member can vary depending on where they happen to live. Most of our members, at least in the UK and in the US, principally we are a customer of their insurer. So the insurer says, look, we need somebody to help you take care of these members. We'll go ahead and give you their premium or go ahead and compensate you, and then you deliver services. So even though we're paid by the insurers, the ultimate person we're serving is really the patient. And the same goes for Rwanda and our other areas of business as well.
So, insurers sort of bring you in to deliver digital health services to their members. They might stratify their population and maybe carve out population and have you manage them on some kind of a capitated model or something along those lines. And you bring in your technology, analytics, and all those capabilities to do it efficiently and improve healthcare outcomes. So that's kind of the vision here. And it makes a lot of sense to me. The question that I have as a consumer, let's say I'm on the other end. So I've got a primary care provider who is trying to do the same things for me. Keep me out of the hospital, help me manage any chronic conditions that I might have, improve my lifestyle, my diet, all the good stuff. Now, I've got my insurer talking to me about the same thing. Maybe behind the scenes, it's a company like yours that's actually designing the program. Now, the question on the consumer is, who should I be talking to? If you're talking to the, whose protocol do I follow? Whose app do I download? Just walk us through a little bit of that. Do you see this at all as a dynamic in your work?
Sure. So I think what you're getting at is we never want to get between somebody who's really satisfied with high quality care and disintermediate that in any way. So I'll say a little bit about how we've operated in a number of areas, and it varies from market to market. So let me just say, in the UK, for example, just like in the US, people choose Medicare Advantage and they sign up and they know what they're getting into. Similarly, in the UK, people elect to have Babylon become their primary care provider. So they're actually choosing us, and we serve them. Now, in places like the US, for example, we are in Missouri, where we serve around 20,000 patients on Medicaid, and we give them care. Now, actually, those individuals, the way this came about was these were individuals that actually were not really engaged in the healthcare system. So what we were very confident. We thought that our model wrong. These are the hardest to reach patients. They're not engaged in care. Can we go out and actually reach them? And so we contacted them, and of them, we actually engage over 20% or so, a little more than that. I'd have to check our numbers, whereas traditionally only about 5% of those individuals have been engaged. So we really try to offer, we never want to supplant traditional care relationships, but we want to reach people that are not engaged, get them engaged. And then if they actually do have a doctor, then we add it on as an extra level of care over that. And then we support them in their journey as well. There's a lot of things that you can't always go to see your PCP for. When people have needs, we try to fill those.
So let's drill into that a little bit.
Yeah.
So you're serving, you talk about the Medicaid population,
Sure.
you're talking about low income, in many cases, underserved populations, possibly geographically spread, and a variety of other factors. Big question that comes up when we talk about these populations is, are they really ready for digital engagement? And, are we really in a position to meet their needs? They may not have the latest smartphones with them. They may be in bandwidth deserts. There's a bunch of other things. Talk to us a little bit about how you overcome that in your work.
Yeah. So I'll say that the question, it's such an interesting conversation, because I think this is precisely the kind of questions that were raised when we initially had gone to Rwanda several years ago. Oh, these individuals won't have access to technology, low bandwidth, and we problem solved around that. Everything from sort of thinking about using telephones when necessary to sort of a more UDDA platform. But getting back to your question, in the US in particular, where we just talked about, I'll just give a little bit of an analogy. Again, this notion that digital health is too complicated or people don't have access was actually tested at the beginning of the COVID pandemic. And at that time, I worked for a very large national payer as a chief medical officer, overseeing an older population, millions of people. And what we saw was when we suddenly started to actually pay for that kind of care and allow physicians and clinicians to use that, we saw a massive increase from less than 1% of individuals to over 15 to 20% of our members were using digital services. And these are people that previously said, they're older, they won't understand it. And it's exactly like it is with social media. When there's a value proposition, people will actually use that. I will say it's not perfect. Absolutely. Some people may not have access to smartphone technology. They may not have access to bandwidth, but at least it's better than what they have now, which is often don't have any access at all. We start on that base, and then we try to problem solve incrementally to get more and more engagement.
Right. And you're basically now you're operating as a virtual primary care provider on behalf of your insurer clients, health plans. Right?
Yes.
You also recently made an acquisition of a primary care physician group.
Yes.
Talk to us about the rationale for that.
Yeah. So I think that what we realize, and maybe again, I'll say one of the great benefits of Babylon is we benefit from years of experience, and we can learn from other parts of the world as well. And one of the learnings we had from experience in the UK is that while digital healthcare, particularly digital primary care, is incredibly accessible and people like it, we could replace about 80 to 90% of a lot of in-person visits with digital care. Now, what that means is we still have 10% that require somebody, and we all know that, right? You probably need, there's some conditions that there's no substitute for being in person. So that was what drove this thought of our acquisition of an IPA in California, which is incredibly high performing. And the idea was, let's now partner with the provider organization and be sure that we now learn how to actually develop both that digital care in the US, but then also understand that how we use that physical presence as well. I mean, that's going to be a scalable model for us more broadly.
So acquiring this physician group was really to build the capacity to serve a larger population, or is that the right way to look at it?
Right. I'd say a couple of things. So the first is that we recognize that we have to develop both that digital and physical presence.
Right.
If we're going to offer primary care, we want to do it longitudinally and in high quality. The second piece of it was we also believe that one of the things we'll also get out of this is that the digital tools we have, we believe they're highly scalable. So what we'd like to do is to also work with physician groups and then transfer this technology to them to ensure that we can also then, can we take existing practices and really digitally supercharge them in some way to also, so it's not only for them to see patients who are largely virtual, but it's for the physicians themselves to learn how to work in a digital first environment as well. And that's part of what we'll also be focusing on, is that digital front door. What are we going to learn? How do we roll that out with those providers?
Now, when we talk about digital front doors, and we're talking right now about actually a hybrid model of care where, for some things you need to go into a clinic, or for some things you need to send a physician out to a home, or whatever the case may be. One of the big things we hear a lot, and we also see a lot in the work that my firm does, is that these experiences can be very, very hard to pull together as a seamless experience from a consumer standpoint. You've got the tool and the widget and everything on your phone, and then you've got to deal with the human and then, the connections. Sometimes there's a loss in translation. Sometimes the experience is not seamless. What are some of the practices that you've incorporated into your solution? Just tell us a little bit about the stack that you've put together and how you're approaching this particular issue of creating seamless experiences from a digital front door standpoint.
Yeah. What I'd say about that is there's a couple steps to being a seamless experience, and we need to solve at multiple points along that continuum. And it starts a seamless experience initially. In our view, we have something we call the health loop, where we talk about all the steps of what a seamless or high quality patient experience would be. And the first step of that loop is engagement. And what that means is how quickly can somebody be onboarded onto the app and get it installed and actually be registered? Now, that seems like a fairly straightforward thing, but the amount of energy and care we put into that experience is enormous. Because, checking insurance, getting birthday, you can just imagine that. So when we talk about a seamless experience, we have a funnel approach. We think about that all along the way. And as I said, it starts with that engagement, that registration. Then it moves to how do we actually acquire data on that individual? We perform a health assessment. Can they do that in a seamless way? We'll try to create a personal connection with a call from one of our care navigators. And then we'll say, well, how do we initially book them into an appointment? And what we've done is, and this is what I'm very proud of, is the vast majority of our patients can actually have a virtual visit even the same day. And if they have a behavioral health concern, within that first week. So what we again think about, that's also technologically informed with our scheduling software and so forth. And then obviously then we have an enormous amount of quality control over the actual experience. We have, over 1,000 engineers, for example, all over the world that are helping us develop that platform. And then we can sort of pull that all the way through all the steps of what that seamless experience is.
How do you keep score of how well you're doing in a program like this? What are some of your key KPIs, if you will?
Yeah. So, what we think about, probably one of our simplest measures, and this is the one we've started with, and actually have a global scorecard on this one, is simply patient satisfaction. It's essentially like a promoter score from our patients. Are they pleased with the experience? And we consistently have, at least in the UK, and if you look at Rwanda as well, and in the US for large parts of business, have just extremely high satisfaction scores. We use sort of a star system there. That's our North Star, and it's sort of on our internal metrics of how we look at quality. Now, obviously, as you can imagine, that's one of the metrics, and then we have an enormous number of operational metrics that then underlie that as well.
Yeah. Now, so let's talk about the competitive landscape. Today, the digital health landscape has come a long way in the last few years, in particular, especially if you use the VC funding numbers as a barometer of growth, right? And there's just billions and billions pouring in, and every day it seems like there's a new company that's raising a Series A, B, C, whatever stage they are in. Now, that is great news from an innovation standpoint. And then, of course, the ones that survive are going to be the ones that make it through this crucible of trial by fire, if you will. Now, obviously, you've come a long way. You're about to become a public company, raise a lot of VC money. But when you look at the landscape and when you look at your clients who are trying to parse through this landscape, pick the platform or the solution provider that's going to be the best suited for their needs. What are some of the challenges that you see them grappling with when they're trying to make a decision about whether it's going to be Babylon Health or somebody else?
So I'll make it very simple, which is that digital health is so exciting to see all these companies competing. We welcome that competition. We think that's only great for members we're going to serve if the highest quality services move forward. I'll say we're one of the only comprehensive digital healthcare companies that are not only talk about our product, but willing to put essentially take full risk. So that's the mark, in my view, of somebody who truly believes in their company, knows they can scale. We take full financial risk on members, and that's sort of where we're going, and most aggressively. Though that's where our contracts are, and that's why our revenue and our revenue targets have grown so much. We believe so much in our product that if we're willing to do that and take that full risk, I think that demonstrates to people it's not just talk, but we'll deliver on that. And most importantly, it's almost no risk for you as a client.
Yeah. And now, sadly, the healthcare system in the United States is still heavily dependent on the fee-for-service model. Yes. It's great to hear that there are solution providers who are driving this push towards more of accountable care and, at-risk models and so on and so forth. It's still unfinished business. So from your perspective, what's going to really move the needle towards more of this? Is it going to come from innovative digital health providers like yourself? Is it going to be changes to the regulatory environment? What's the one thing that you think is going to put it over the top and make us all become part of an accountable care model?
Yeah. Well, I would say, just simply put, we all do best when we have to operate within a defined budget and deliver based on metrics. I mean, I think that's sort of at its core when we talk about value-based care. It's most simply saying, look, you need to give good quality to the budget. So to me, that move towards full risk, particularly on digital health, is the key that unlocks growth. Then we don't fight over regulatory issues like, is Medicare paying for home-based remote monitoring? Are they, doing cross-state license payments? When you offload that risk to companies that actually are digitally enabled and let them pursue what they think is best, I personally believe that's what the unlock is.
Sure, and I think this is still unfinished business. We're all waiting for this to kind of play out over the next few years or so. So we're coming up to the closing moments of our conversation, yeah. Darshak. I'd love to hear your final thoughts, if you will, on what are the 2 or 3 big trends you're seeing in the market when it comes to digital health adoption that consumers like me should be looking for?
Yeah. So I'd say from the consumer standpoint, a couple of things. The first is that does your digital health company give you just a one-time experience? Like, are they designed just around taking care of your coughs and colds and maybe your reproductive health needs? Or are they truly giving you a longitudinal care experience where you want to develop a relationship with trust over time and actually take care of you at all of those periods? To me, that's actually the direction in which we're going. As a consumer, that would be very important. I don't want a one and done. I want to make sure that we push once. The second thing I would say is that how well are they optimized to do the simple things? Because, it's like those stories about, those rock stars who say that in the bowl of M&Ms, they want to make sure that there's no green M&Ms when they write the contract.
I know which
that
one.
happens doing everything else right. I mean, Similarly, that's the same thing. Look at your digital health platform. How easy do they make it to make an appointment? Do they refill your medications on time? Do they do those simple things? And as a consumer, if they're doing those things right, then you can have some confidence they're going to do the hard things right as well. That's the second thing I'd leave your audience with.
Fantastic. Well, it's been such a great pleasure speaking with you. I'm really excited about all the innovation that's coming out in the digital health space. And of course, great work by Babylon Health. All the best once again with the SPAC. And I look forward to watching your company and your growth, and all the very, very best to you and your team.
Patty, great pleasure to talk to you. Thanks for having me on.
Take care. Bye now.